Hi, my name is Dr. Colin, and I'm at Gentling Dental, and I'm here to answer your questions on endodontics.
Dr. Colin, is the tooth dead afterwards?
The tooth is dead, yes, and we, of course, say the tooth is non-vital. The reason for that is because the tooth, even though it is non-vital, still has a function in the mouth and still functions normally. Now, what do I mean by that? What I mean is that the tooth is attached to the socket by very small, tiny fibers called ligaments. The ligaments are tiny fibers that hold or attach the root to the bone. The periodontal ligament acts as a cushion. Without this cushioning effect, you would not have any give to that tooth, and without that give, you would have multiple fractures. So, even though the tooth itself is non-vital, and we render it preserved or sterile, if you will, through root canal, even though the tooth is non-vital, it acts as a normal vital tooth because the ligament is still alive. The ligament still has nerve structure, innervation, it still has vascular structure and vascular innervation. So it has a blood supply and nerve supply. And it will act as though the tooth is alive, even though, in fact, the tooth is non-vital. But we render the tooth non-vital, we render the tooth when we preserve the tooth so that it can be used in a normal function.
How long does this treatment last?
So root canals themselves should last really as long as the patient can keep the tooth. The only reason a root canal will fail is if the seal at the root tip, for some reason or other, fails. And this can happen. It doesn't happen very often, but when it does, what we do is we re-access the tooth. We re-enter the tooth, and we re-perform or retreat the root canal. My experience is that probably less than 2% of all root canals need to be retreated. That's been my experience. Others may vary, but my experience is about 1 to 2%. If it needs to be retreated, it's a pretty simple procedure to go in there and retreat the tooth in our office. The other reason why a root canal might fail is that the tooth may be fractured. We try not to do any root canals on multi-rooted teeth, which are bicuspids and molars. We try not to do them at all until the patient also agrees to have the tooth crowned. If the tooth isn't crowned, then you risk fracture because that tooth, being non-vital, will become brittle. And if it isn't protected with a crown, if something hard is hit during chewing, the tooth has a possibility, because it's brittle, of fracturing. So if the tooth fractures, the root canal can fail. And in that case, the only alternative is extraction. So we want to make sure that on multi-rooted teeth especially, the teeth are protected by crowns.